Good morning, good morning, good morning, panel. Good morning to the folks that we cannot see, but we know that you're here. So good morning. Welcome to the Healthcare Financial Management Association's morning panel on provider, payer, and community partnerships driving total cost of care. My name is Kimberly Harris, and I'm the Director for Community Health and Social Impact for the National Capital Area at Carefirst Blue Cross Blue Shield. We are so excited to be here with you this morning to discuss economic inclusion, what it is and why it impacts the health of the individuals and communities that we serve. Carefirst recently invested over $2 million in the first round of our economic inclusion grants to 16 nonprofits and small businesses in Washington, D.C., Maryland, Northern Virginia, and the focus is on capacity building, increased access to capital, workforce development. A few of our wonderful partners have joined me. I can call them friends now. We spent a lot of time together talking about this project and making sure that we're advancing their missions, but really excited to talk about the work that they're doing and why it's important. Some of you may be wondering why a health insurance company like Carefirst is investing in economic inclusion. The health of our community is determined by intersecting clinical and non-clinical factors. We call the non-clinical factors social determinants of health. Social determinants of health include, but are not limited to, access to quality education, healthy food options, and well-paying jobs. These factors are much harder to address within the walls of the doctor's office. To create healthy communities for all, we must proactively address social determinants of health, the root causes of health disparities and inequities. To put it simply, our goal and the goal of this project is to have an inclusive economy where all people have the knowledge, skills, connections, and resources they need to thrive. This brings me to the work that we do with community partners on the front lines, living and working in communities we call home. With that said, I'd like to introduce our panelists. I feel like these are our starting five. While we do have other grantees, these are the folks that are with us today. And they're our starting five, doing very good work across our service area being Carefirst service area in Maryland, DC, and Virginia, Northern Virginia. Richard Trent is the Executive Director for Friends of Anacostia Park. Friends of Anacostia Park works to preserve Anacostia Park and connect surrounding communities to its redevelopment via beautification and workforce development. Bree Jones, founder of Parity Homes, and this is my favorite thing to say, Bree. Home is where the health is. Parity Homes acquires and rehabilitates abandoned properties in West Baltimore to combat gentrification and displacement and promote affordable home ownership. Gabriela Lemus, Executive Director for Maryland Latinos Unidos. Maryland Latinos Unidos is a network of organizations, businesses, and individuals all working to support Latino and immigrant communities by way of nonprofit services, public policy, and joint advocacy. Lauren Goldschmidt, Director of Community Service for Service Source. Service Source facilitates services, resources, and partnerships to support people with disabilities, their families, and caregivers to build a diverse and inclusive community. Van Brooks. Van is the founder of Safe Alternatives for Education. Safe Alternatives provides after-school, weekend, and summer learning educational opportunities for youth through vocational programs, providing real-world application and access to resources outside of their schooling. Now that we have our starting five, I would like to direct my first question to Van. Van, how did you identify the need for your organization, and more specifically, this project with Carefirst? Why does it make your community better?
So I'm born and raised in the community that I am working in. And so I always believe in starting right in your backyard. So going to private schools, I've identified the differences in the education opportunities and resources that I had compared to my siblings and those in my community. And so just growing up in the community and seeing what my friends were struggling with, I was able to identify the need. And then of course, once you get into it and start to do more research, you start to find out more and more and more as you dive deeper, kind of like go down that rabbit hole. And so that's basically how I figured out the lane that I wanted to go into and how we were going to begin to address those things. based off of just my lived experiences in the community, but also my educational background, and seeing just the differences there. The partnership with Carefirst came in. Everything that we were looking at, as you mentioned earlier in your intro, was all around social determinants of health, education, access, resources, opportunity. And so our goal through this partnership is to just provide all of those things, starting in the middle school, helping them identify certain things, but of course, going to the household with the parents. And then now we're going to go all the way up to the ages of 24.
Thank you, Van. Bree, so you're one of the other organizations representing West Baltimore. How did you identify the need for your project? And do you consider, any overlaps or, complements to the work that Van is doing in West Baltimore?
Yeah, so first, thank you to Kimberly and Carefirst for the invitation, and good morning to my fellow panelists. And I wish I could see the faces of the attendees, but I know you're there smiling. So I, kind of on the heels of what Van said, starting first in your backyard, I'm from New York originally, and I first started this work in New York. I didn't go to school to be a real estate developer. I was on a totally different track in my life, but my hometown began to be gentrified. And so I became a community organizer and advocate, trying to call the developers to the table to make sure that the needs of my community were being met, and we were building affordable housing, and we were hiring people locally. And by and large, we were steamrolled by the developers. They didn't take into consideration what we were asking for. And 6 years later, my neighborhood is totally gentrified. It is totally transformed and for the worse. And by and large, most of New York at this point is gentrified, and there's very few opportunities to do affordable housing, especially affordable homeownership at scale. So kind of being displaced from my community, I kind of had a turning point and a pivotal moment. And I said, okay, Bree, you can either continue to stay on your career track. And I was working in finance. So I kind of had my future set out for me, or I could do what would be hard and painful, and, it would be a struggle, but it would be worthwhile. And that was trying to prevent what happened in my neighborhood from happening in other communities across the country, specifically Black neighborhoods that have been disinvested, that have been redlined, and that are struggling with all of this economic fallout, but are still intrinsically valuable and deserve to be equitably restored. And so, long story short, I found myself in Baltimore, and I haven't left since. And I'm just so thankful that Baltimore has welcomed me with open arms. And so on that note, I've gotten to know Van quite a bit, and he's like a local Baltimore hero. I look up to him. And I would say that I think our work overlaps in quite a few ways. Parity is mostly focused on homeownership, but we're starting to think about workforce development, because as we build our homes, we're realizing that there's simply not enough people in the construction trades to just have a steady pipeline of folks to be, rebuilding all of these vacant buildings. And then when you also look at Baltimore's kind of socioeconomic statistics, we're a majority Black city, but Black folks, particularly Black men, are disproportionately unemployed or underemployed. So there's a gap happening where we have all of these folks who are looking for jobs, and then we have all of these companies like myself who are looking for people in carpentry and in the trades. And for some reason, there's not a gap, there's this gap happening. Van mostly focuses on education and workforce development opportunities, but he's slowly starting to get into real estate development and housing. And so we've started to kind of plant seeds to see how our organizations can be working together in the future, especially because I'm north of the highway to nowhere, Van is south of the highway to nowhere, but we're both in West Baltimore. So I feel like our organizations are going to start, hopefully, sometime in the near future, going to be working more closely together. But nonetheless, I get a lot of inspiration from Van, and he's doing great work.
Yeah, Bree, you said a couple of things that stuck out to me. The doing what's right and not what's easy. And we know that this is a long road. You know, it's been a marathon. We've made good strides, and we have, you know, more ways to go, but certainly deciding to do what's right, even when it's not easy. And then also that connection to Van, especially with the vocational work that he's doing, those training and certification programs that he has. And the two of you, actually, that is the goal in this, right? Looking at the social services, providing, you know, the training and education to build a pipeline for jobs within the communities that you serve. So really excited about all of what you said about the opportunities that you have and the relationships that you all have developed, and hopefully that we can get that off the road, off the ground. And so I'm going to go a little further south, so from Baltimore to DC. Richard, why did Friends of Anacostia Park start? What's the need in the community, and how does that work you're doing overall impact the economy?
Yeah, so friends groups exist in parks across the country, right? There's a friends group in Yosemite, there's a friends group in Grand Canyon, but Grand Canyon and Yosemite are not national parks in the middle of a bustling city with a large historically underserved population. And so when you think about my community where I live and and work, Anacostia, we're talking about a community of mostly Black and brown folks. Only about 30% of folks in this community are homeowners. So to Bree's earlier point about gentrification and how ravaging that can be for Black and brown communities, when you see new developments, if you're a homeowner in Anacostia and you see new developments, it's like, oh, exciting. But if you're the 70% of Anacostia residents that don't actually own the property where they live, then it's kind of terrifying. Coupled with that sort of economic precarity is health insecurity, right? We've got folks who by and large are suffering from higher rates of hypertension, diabetes, all here in Anacostia. So when the National Park Foundation started working with the National Park Service, local philanthropies, and the DC-based environmental activist Akima Price back in 2018 to figure out how they could build grassroots support for a friends group that would actually center the needs of the community in the process of revitalizing the park. They brought on a bunch of different stakeholders and started holding really informal meetings, barbecues, all at the Anacostia Park Skating Pavilion. What happened over the course of 3 years is a truly ground truth, community-led friends group that couples the revitalization and uplift of the park with the revitalization and uplift of the surrounding community. What this means for our actual programming is that we look for every single opportunity imaginable to marry park work and park uplift and revitalization with economic uplift for the surrounding community. So we typically view things through the lenses of park health and people health, right? So so the Friends Corps, which is the program that Carefirst is funding under its economic inclusion banner, and we're unbelievably grateful for this partnership. The Friends Corps actually provides now 12 Anacostia residents, all BIPOC individuals from low-income housing. Some of them are returning citizens, right? So just coming home. Some are elders in the community, but this actually provides those folks with living wage work in the park, where they're working alongside park rangers, doing everything from wetland restoration to invasive species removal to just holding park goers accountable for the way that they're using their space. So 12 people in a city of, or in an area of the city of 70,000 people may not necessarily be like a panacea for all of the community's socioeconomic ills. But what it does show is that this is a replicable, duplicable model. There are friends groups and national parks, state parks all across the country. And so what we're hoping is that folks kind of get hip to what it is that we're doing, and take it upon themselves to replicate this model in their own backyard.
Thank you, Richard. I'm really excited about, the beautification of the park, of course, but also having residents pour into that. When residents are involved in the process in the community, that buy-in is there, and I think you all received that buy-in, early on. We are excited. We do have a group of associates or difference makers that will be going out to the park to do some volunteer work next month to share our time, talent, and treasures in a different way. So get the mulch ready for us and the paint for the benches. We'll definitely be out there to support.
Oh, we're gonna put you to work.
I'll make sure I have my sunscreen on. That brings me to Lauren at Service Source. Lauren, this is, I think in terms of what you all are doing for the community and individuals that you serve, can you share a little bit about what Service Source is doing to improve the economy for the individuals you serve? And tell us a bit about the population, your target population.
Sure. So Service Source has been in the Northern Virginia community for over 50 years. We started with serving individuals with developmental disabilities in Fairfax County. It started with a group of parents who really were concerned about their sons and daughters with disabilities exiting high school and what was going to happen to their sons and daughters and what resources, what programs were available to them. And they didn't like what they saw. And so they wanted to create something. So from that, we are now in multiple different regions, serving over 30,000 people across those different regional offices, which is just amazing to think about when you think about that. It started with a group of just determined parents to figure out a solution. Through the years, we've expanded to work with people with mental health diagnoses, substance use disorders, individuals without disabilities, but they have barriers to employment due to poverty, housing insecurity, maybe they're returning citizens. And in particular, we were seeing an intersection between disability and poverty. We saw in Northern Virginia unemployment rates continuing to increase, unfortunately, when someone might be a member who might have a disability and be a member of the BIPOC community. In Fairfax County, for instance, which is a very wealthy county, neighborhoods that were 5 miles apart from one another, we were seeing a very different outlook on employment rates and poverty rates. And there are clear economic inequities when looking at the poverty levels and the economic rates and of people with disabilities, of members of the BIPOC community. And those just exacerbate when there's an intersection. And we really wanted to figure out how can we not just get people employed, but how can we help them to find employment that's meaningful, that's a living wage, that brings people out of poverty. And a key part of bridging that gap is helping people to connect with non-traditional educational pathways and looking at industry recognized certifications. Our program with Carefirst focuses on the IT field, and others, focus on trades and I see a lot of intersection even across the states, which is fantastic. I'd love to talk with more of the panelists in more detail. But how can we create opportunities that lead to better employment and lead to movement out of poverty within individuals' neighborhoods? So that is our focus for the Carefirst grant.
Thank you, Lauren. I think you made just hearing everybody talking. We talked about the barriers, we talked about housing, we talked about poverty, we talked about disability, we talked about employment, we talked about educational pathways. And another goal of this project is really to help you all advance your mission, really pouring in from that capacity building, increase access to capital, as well as workforce development to help you advance your mission. You guys are tackling some pretty heavy things. And we're talking about social determinants of health. And then, some of the folks who are on the phone or may review this later, you can't leave out the social factors when you're addressing clinical issues. And so I think it's very important when you have someone, who comes in with a chronic condition that their housing may be unstable or in a condition that's not conducive to health. We have to really make sure that we overlay those social factors that can and have impacted health. The other thing that you said and that I value about this project is that we are across the Carefirst service area in Northern Virginia, DC, and Maryland, and just that cross collaboration or ideas in terms of, what Bree might be doing in Baltimore that she did in New York that could be done in DC. Workforce development opportunities and cross pollination from what Lauren may be doing and how that can connect with Gabriela or Richard. And so just really excited. Coming from I worked for district government for some time, and sometimes it's like BCDC, but we know that it's a regional effort, and there's some overlaps and gaps that need to be filled. So Gabriela, I want to move to you. You're one of the unique organizations on the call today, in the sense that you support other nonprofits and grassroots leaders. Can you describe the project that you have with Carefirst, and how do you measure the success, especially working with multiple organizations?
Well, thank you so much. I'm really excited about this project, to be honest, because I feel like it's exactly what I should be doing as the organization that we are, right? And really our work has been around supporting capacity building for the Latinx nonprofit sector in Maryland. And overall, because I'm housed inside Maryland nonprofits, and their whole purpose is to build a stronger nonprofit sector across the state, it's a really beautiful encasement of all the 30 years of experience that they have, but then my unique emphasis on building infrastructure for the Latino community within the state of Maryland. Something I think that is really important to bear in mind is, we started this work on the basis of information and in both community engagement and sector engagement. And we learned a couple of things. I did a survey, for example, on social, economic, and environmental justice that came out in June. And what we found that the community members, access to healthcare was the most important thing. Latino representation at every level, corporate, government, et cetera, was important. Affordable housing, education, economic justice, including fair wages and fair progressive taxes, food insecurity and injustice, and then, obviously the criminal justice system, police and prison reform. On the other side of it, because we dove down into the environmental justice pieces, and this is why I got kind of excited when I was listening to Richard's work. Access to safe and reliable public transportation, green jobs investments in overburdened and underserved communities, access to green space, so kids could go outside and exercise and enjoy fresh air, but also clean air and potable water and sustainable agriculture. So what the sector surveys found was that we all as organizations need help in capacity building, collaboration, and advocacy. And I feel like this project is sort of like the perfect convergence of all of those issues. Every single one of you brought up the issues of social determinants of health. And when you look at what the community is saying, it's precisely that. These are the areas where we're being impacted. So if you don't have clean water or clean air, chances are you have more than likely some kind of chronic condition related to that, whether it's asthma, which so many Latinos and African Americans are disproportionately represented in that space and are often most likely to end up in the hospital compared to other folks, and then tie that to your housing, right? Which is what Bree and Van are looking at, which is, do you have safe housing? Are you in a place, and even you, Lauren, communities with disabilities, like, do you have a safe space to live in? Can you be in a healthy home? So all of this comes together. And what I get the opportunity of doing, because we started out of COVID, what we learned in COVID was that the Latino infrastructure in the state was very weak, and everybody was struggling trying to figure out how do you get across the barriers that were in place, mostly linguistic and cultural competency, but there's even other barriers related to the fact that we're underinsured and, I would even say uninsured as a community compared to the rest of the population. And so that creates other kinds of issue areas. And so, I'm bringing together these groups that are already in existence. I'm helping them, I'm responding to their needs right? At least that's my goal. These funds from Carefirst are allowing me to do that. And while we're doing that, we're raising up the advocacy pieces, and we're raising up the community itself, but also how we participate with everyone else. How do we fit in, and how do we build up the nonprofit infrastructure, which from my perspective, I just feel so strongly that when you look at economic development and inclusion, it's not just government and the private sector, it's the nonprofit sector too. And it is so valuable to raise it up and build it up, because we're also providing jobs. We're also building the economy. For every dollar we invest, or you invest as funders, there's a return of $2-3 to that. So there is an ROI. And then there's just that really good part, the part that feels good. We're helping people be healthy. We're helping people be stronger. We're helping people build their communities and fight against things like gentrification, and come together and see those common paths.
Thank you for sharing that. I hearing all of this and wanting to, how are we measuring success? And you guys can jump in, whoever sees fit. But how are you measuring success? How do you know that you reached yes, or the finish line, or that goal? How are you guys measuring success?
Well, I'm happy to hop in. In my sense, it's a little easier because it's nonprofit by nonprofit. So literally nonprofit by nonprofit, one at a time. Who, are they being able to take the information that we're helping them pull together and become more sustainable, become stronger, and then be able to fulfill their missions. But then in turn, how is that affecting and impacting the community? And so, for example, an example that I would give you is through collaboration, we created a coalition called MALVEC, which is a very long name, but basically it's the Latino Vaccine Equity Coalition for the Maryland. And we brought together these amazing partners: Johns Hopkins, George Washington, CASA, Community Health and Education, through Empowerment Through Education and Research. I mean, a whole host of nonprofits. Altogether, we collaborated with 92 organizations. We vaccinated over 22,000 Latinos that everybody said were impossible to get reach, into that community. We reached almost 40,000 families with information and helped fight disinformation, because we're part of a bigger picture. There's a lot going on around us.
Thank you. Thank you.
I'll hop in and just say that it's no surprise to me that that our organization started picking up momentum in the middle of the pandemic, when the importance of green space and parks was kind of elevated in our collective consciousness. And so, I mean, the most obvious metric that we track along with the National Park Service is just increased park use. So one of the sort of soft benefits of a program like the Friends Corps Workforce Development Program that we're leading in partnership with Carefirst is that if you go to Anacostia Park and one of these flat brimmed park rangers walks up to you and tells you clean up after yourself, it kind of like it hits a certain way. It's like it's a little tough. But when you have Phyllis from the community who grew up in public housing, who knows half the people down at the park, telling you to clean up after yourself and to make sure that you don't litter and to take care of the park space, that is the type of just sort of small sort of twists, right? That actually it increases folks' sense of ownership over the space, right? And it increases access by saying, "Oh my God, that's Phyllis. People like me are down here at the park." And so that's one of the I think the other the big benefits of the Friends Corps program that we don't always talk about is just seeing people down at the park that look like you can actually have a real measurable impact on park use.
Yeah, we certainly don't want to disappoint Miss Phyllis. I think we all have a Miss Phyllis in the communities that we grew up in, and seeing that. I mean, I can think of my own Miss Phyllis. When I see her now, and I'm an adult, it's let me straighten up and do what's right.
Well, you'll meet her in a couple weeks.
So I'll have a local Miss Phyllis, another one at the Anacostia Park, right? I look forward to that. Van, I'm going to jump to you. We've talked about a lot of things, and I think, again, one of those things that we talked about, that we're doing what's right and not what's easy. And so when we're doing what's right and it's a little hard, we have some obstacles. And so wanting to talk to the group, but I'll start with you, Van. What are some of the obstacles that you all face that might not be quite as obvious?
So one of the biggest ones is our model of starting with middle school students. It's really hard to find partners that will dive as deep as you all are diving with us when we talk about exposing students to potential career opportunities and actually taking them onto work sites. Thinking about the construction industry, taking them onto work sites and actually seeing it being done, actually getting their hands dirty doing the work. So many people, surprisingly, was like, we're going to stay away from that because are the kids really old enough to truly understand what it is? And for me, it's always about, plant the seed as early as possible. Every kid isn't going to gravitate to everything, but at least they can make an informed decision based off of something that they've tried and being there and doing it versus someone just, mentioning, oh, I don't like this, so I don't like this, right? We know how middle school kids can be. If a friend of theirs don't like it, they don't like it until they actually get out and experience it. So that has been one of the biggest barriers is really getting people on board to see the benefit in doing that work. The other thing that was a huge barrier was the around causality. Because we start with middle school students, and we're tracking our students to see where they go to high school, where they end up at if they go to college, or post-secondary options. That causality piece of things was around how do you know what you're doing in the middle school is having an impact on where they end up later down in life. And so we've come up with a pretty good solution around that, which is simply comparing, because now that our kids are old enough, looking at the first cohort of students that we've had go through the program and seeing what we did with them and then being able to monitor and track that, right? So if we stay along that same path, are we having similar outcomes? If not, what have we tweaked that has changed the outcomes that we hope to see, but also the outcomes that our students that we're working with hope to see? So those would be the two biggest things that we've had to address.
Thanks, Van. Lauren, how about you? What are some of the obstacles that you face that might be quite obvious?
I mean, one is very similar to what Van said. We also work with employers to engage individual job seekers with tours, job shadowing, informational interviews, short-term work experiences to be able to build their resume and learn more about what they're interested in doing. And we're always looking for more employer partners to be able to support that. So similar challenges that Van has in regards to that. But some of the obstacles that come about are in people's own communities and own houses, unfortunately. We know that a stable living wage, economic stability, access to quality education, those are all vital parts of an overall health of communities and individuals. Those are key social determinants of health. But when individuals are living in an insecure housing environment or in a neighborhood with higher poverty levels, there are obstacles being thrown in the pathway every day to be able to access that quality education and to finish the quality education to be able to then move forward and find meaningful employment. And that might be, worrying about paying rent. It might be health issues that they aren't able to fully pay for. And it could be a lot of different things that people that are impacting individuals to be able to finish that, finish what is going to be helpful for them in the long run. But in the moment, those obstacles are being thrown in people's paths. And so, servicers were fortunate that we were able to include in our Carefirst grant access to community resources, align some funds to be able to, someone says, I really want to finish this program, but I can't afford my prescription. That's going to be able to help me to concentrate and be able to finish this. Well, we can use those community resources to pay for that prescription. So really being able to look holistically at what is going to benefit the individual to be able to access and complete and then have enough stability to be able to move forward in a positive way and make that progress that they're looking to make.
Thank you. One of the things you said, holistic, right? Looking at it, it's not just one part of the person that we're solving for. It is absolutely a holistic approach. And some of the obstacles that you shared and just that statement alone reminds me of how important community clinical linkages really is, in terms of we talk about multi-sector partnership and all of those things, but really needing a plan and be at the table together, solving for some of these issues with community clinical linkages. And those are the connections between community and clinical sectors to improve population health. So those are the, public health organizations, those are the clinical organizations and community-based organizations like you guys. We talked about some of the obstacles that are very prevalent. The data is all over it, right? But when you're thinking about health and some of these people that have comorbidities, et cetera, and then they're looking at trying to get, a livable wage, but you're chronically ill most of the time. And so how do we come together with some of those social services and clinical services to provide holistic health?
And I want to add that, the main goal is to connect people with quality healthcare and to support them to access those resources while they're also, pursuing education, access those affordable and hopefully quality healthcare. And when we have that line item to help remove those barriers, that's a kind of like a stopgap measure. That's not a permanent solution. And so the goal is to connect people to more long-term resources where they can access those vital needs that they have on a more long-term basis.
Absolutely. Bree, we talked about this a little bit. We're going to switch gears again about your project and, wanting to know, is this something that you think that you want to see replicated in other areas that have a similar need? Is this something you think others can do? Just want to hear your thoughts about, if you think this is replicable and should others be involved in this?
Yeah, 100%. I think it's something that can be replicated because what makes Parity distinct and also what makes Parity successful is that we are renovating or we're restoring distressed communities primarily with social capital. A lot of folks think, it's the financial capital or political capital, and that's important, but really what got our project off the ground was social capital, and that's something that is free and in abundance, and that can be tapped into really easily. So what do I mean by all of that? So what Parity does is we're working in Harlem Park, West Baltimore. There's about 40% of the buildings there are vacant and or abandoned. And it's kind of been this way for the last decade or two, and it's just kind of continuing on that trajectory. And when I kind of, had this vision for purchasing these abandoned buildings, renovating them, and then selling them affordably to local residents so that they could have home ownership opportunities, by and large, the pushback from investors or the pushback even from the city's housing department was that you're going to build these homes and no one's going to want to live there. People just don't find these neighborhoods desirable. People are fleeing, like all of this kind of like deficit-based language. And I knew that that was innately wrong and that there were people who want to live in these communities, and there's simply just barriers to opportunity because of the literal physical conditions of the buildings. But if we were able to rebuild them, that people would be just so incredibly excited about these opportunities. And so to kind of prove the naysayers wrong, I said, well, if you don't think there's a market, I'll prove that there's a market. And that was where our social collective was born from, where I literally just kind of went to different neighborhood events and neighborhood council meetings. And I'm like, hey guys, if we built these buildings up, would you want to live here? And everyone was like, yeah, I would. And so we had 40 people throughout the course of a year of me just kind of like asking folks if they were interested. 40 people were like, yeah, sign me up. And so we pre-sold these houses before Parity even owned a house, before we even raised funds to buy a property. But we had 40 people who said, if you can do this, we are committed. And so we've had folks who have been working with us since 2019, whose homes are under construction today and who are already under contract to purchase the homes when they're done in November. And so demonstrating that kind of initial buy-in is what really kind of allowed the project to take off. And that when we could demonstrate, here are 40 people who are willing to buy these houses, we were then able to raise the financial capital and able to garner the political capital to support the project. What was the original question, Kimberly? I forgot where I was going with that.
Well, listen, I took two things from that. Don't tell Bree no. Do not tell Bree no, because she'll show you otherwise. And then also the importance of community buy-in. And so I was just asking if you thought that this would be something that others would want to
replicatable. So that was the punchline. That's where I was going with it. So the reason I give that backstory is because, again, just talking about my experience in New York, when our community members started to mobilize and we went back to this big developer and we were like, we don't want this in our neighborhood. They were like, well, it's not going to happen if we don't do it. Like if we don't develop this neighborhood, no one ever will. And now that I'm on the other side of that, I know that that is unequivocally incorrect and that your neighborhood has value. There are a lot of cities that are struggling with the same things that Baltimore is: St. Louis, Chicago, New Orleans, Detroit, and DC was where Baltimore is 10 years ago. And unfortunately, it's now being gentrified. So I say all that to say that if your community is still struggling with disinvestment, it might feel impossible, but it really isn't. And all you kind of need to do to jumpstart equitable redevelopment in your community is to build that social capital and to demonstrate that there is demand for affordable, equitable housing in your neighborhood, and then partner with mission-aligned developers, whether it's Enterprise or L&M or the community builders, or, name them. There are quite a few developers that really do want to see mission-driven community housing and development brought to fruition. But I think it has to be led first by on-the-ground community efforts.
Thank you. Yes, absolutely. The mission-driven work, and that's exactly what Carefirst, that's what we do. Advancing the mission, but it's mission-driven investments, and we're really dedicated to that. I think we've done a good job at, for those who may not understand the correlation between, economic inclusion and health, but I just wanted to share a couple things from the Robert Wood Johnson Foundation as it relates to economic inclusion and health. Income is strongly associated with morbidity and mortality across the income distribution, and income-related health disparities appear to be growing over time. Again, why we're doing this. Poor health also contributes to reduced income. We talked about that. And if I have a chronic disease, how present am I at my job? Are there some gaps there in terms of unemployment, et cetera? And that reduced income, it creates a negative feedback loop, and sometimes is called health poverty gap. So you have this poor health, you have reduced income because you can't work, and then it's just this loop of a health poverty gap, and sometimes generational as well. And then the last thing I wanted to share from Robert Wood Johnson is income inequality has grown substantially over the decades, which may perpetuate or exacerbate health disparities. And I think we've seen some of that. So it's really important. I talked about this earlier, where we're proactively addressing these health disparities. And I think overall, as a group, a country, as a region, we're talking about the hard things and unapologetically coming up with solutions in a proactive way. So certainly interested in continuing that. the work that we're doing. So with that said, I'll pitch it to Richard here, and then if somebody wants to jump in, how would you say the work that you're doing directly impacts the health of your community and the people that you serve?
Yeah, so I think that the exciting thing about conversations like this is the way that it kind of increases the surface area of this thing that we call health, right? And if you think of someone like, and I'll go back to Phyllis on our Friends Corps, who's the senior manager on our Friends Corps. Phyllis, before she arrived at came to the park and started working with us, she had just finished 35 years of being sober, and from drug use and alcohol, but she chain smokes like no other. Oh my God, she smokes just packs. And we talked to Phyllis as soon as she kind of took on this leadership role with the Friends Corps about, like, listen, Phyllis, it's not a good look to be smoking in the park. Like, there's people coming around, and so she mentioned to us that she was just getting in a financial position where she could actually purchase, I forget the name of the drug, I think it's Chantix, or it's some sort of drug that you can take, the medicine that you can take that helps with quitting smoking. And so this was like a concrete example of how her newly improved economic plight was putting her in a situation where she could actually access the medical resources that she needed to tackle serious challenges. So that's a concrete example of the way that economic inclusion and workforce development can have serious impacts on just the way people live their daily lives. But I think the sort of radiating out from our program, not sort of looking internally at our core, so much of the health ailments and issues that Anacostia residents face are directly related to stress. And there's hundreds of studies talking about, stress reduction and what it means for, living longer and all these different things. Well, respite programming in the park is something that our Friends Corps has taken on in a very big way over the last few months. So everything from our community fishing program every Saturday morning at 10 a.m. that welcomes older adults, veterans, and returning citizens down to the water for angling instruction from Mr. Holmes, who leads the community fishing program. That sort of consistent entry point into sort of healthy park activities is actually a stress reducer, right? We have respite activities for teachers at Anacostia High School who are unbelievably stressed after a year of, dealing with pandemic regulations and our kids going to be in school and all these different things. We welcome them down to the park to show love, grill out for them, provide free skate rentals. These small little sort of touches, right, of just showing that you care and leveraging and activating park space for the benefit of community health actually has massive economic impact and sort of just the way that people access healthcare.
Perfect. Yeah, and we talk about real life, going from, having an addiction and sort of working your way, like I'm still smoking cigarettes, but I'm trying, and then coming to a place where she's really pouring into the community where she grew up and still hasn't given up. And I think programs like all of you all are operating are giving hope to the residents and then the next generation as well. And so we're coming close on time, and I could talk to you guys all day long. But I'm gonna break so we can have a chance to do some Q&A from the group. I think we have some questions in the chat, and then we'll wrap it up.
Yes, hi, Kim, thank you. And thank you to all the panelists. So I'm going to read through a couple of the questions, really good questions here and great discussion. The first one is about, the negativity of the media sometimes can be very discouraging. And so they're asking, are you as organizations working actively to change the narrative and try to get this positive message out of all the great work that you're doing?
I can hop in there. This year, we just brought on board our director of brand strategy and storytelling, because what I've realized through my growth as a leader and through Parity's evolution is that Baltimore, people would say it has a crime issue, it has a this issue. Really, Baltimore has a narrative issue, and that, again, the media looks at Baltimore from a deficit lens when there's so much, again, intrinsic value in the city that if you're not like on the ground and if you're not looking at the city with that lens, you'll totally miss it. And I think, again, it's just demonstrated by the fact that we had 40 people who are like, I love this neighborhood despite the boarded up windows and all that stuff. And right now our wait list to become a Parity homeowner we have 400 people, over 400 people on our wait list. So that demonstrates that there is an incongruity, if that's a word, between how people are perceiving, like how people talk about Baltimore and how people actually like value Baltimore. So I say all that to say that with our director of brand strategy and storytelling, we're working on releasing like a series of videos, small kind of like reel that you could put on Instagram or like TikToks, but just like quickly showing people that there's like another story. It's like the danger of the single story. Baltimore has so many stories and we want to highlight that. So that's what I'm really excited about.
Actually, can I piggyback off of Bree really quick?
Yes.
Because I agree 100% with that. And that's one of the things that we do at SAFE. We work on controlling our own narrative. And with social media, we can do that. And it makes it a lot easier for us to do that. Something as simple as a group of kids gathering on the corner. Some may think that they're looking to do something negative when they could actually be organizing a cleanup, right? So just helping people understand that what is portrayed really isn't Baltimore, right? No matter where you go, there's going to be crime. But there's more good things happening in those same communities that people say are crime-ridden that never get shown. And then the other thing I'll end on is people are looking for an opportunity. You give them an opportunity to do something different, they'll take it every time because no one wants to be out committing crimes, right? I mean, you may have a handful of people, but that's not the vast majority of people. So provide them with an opportunity and we'll be able to see how things will dramatically shift.
Can I hop in too?
Yeah.
Part of what we're doing, we also just recently hired a communications strategist to help us get message out. And we have it sort of even more complicated because we have to do it bilingually. So there's that aspect, is ensuring that that the community is being understood, because it's sort of like twofold. One is educating the community and raising awareness about what's going on around them, but also the service providers and government agencies, et cetera, as they engage with the community, that they understand what the realities are as well. So it's a twofold piece. And I think in our case, part of what really, and this is a challenge, and I think it's a really valid question on media, because one of the challenges we have related to our narrative is also what we're hearing. And Latinos get, 69% of Latinos get their news through YouTube. Which, if there's disinformation, whether it's about a COVID vaccine or about monkeypox, or something, even asthma, it can really hurt the community. So there's that piece, and so we're trying to build. Well, everybody we talk to is hopefully going to become a trusted messenger, right? And that they are also carrying out this message and these stories and these vignettes of what's going on in these communities. Because I think there's a tendency, especially in the Latino space, or about the Latino space, to think of us as the Latinos. Well, in reality, we come from about 26 different countries, right? And we all have different accents, but we share certain commonalities. Just like Americans. So, it's kind of critical, I think, for us to get that message out, but also to ensure that our communities understand where they stand and where they can get good information.
Before we move on, the next, I want to say quickly that that's another part of this project in terms of the resource that Carefirst is providing. Our communications department is committed to helping these organizations tell their story. For example, we did do a feature on ban on stage some time ago. You've seen that circulating, and so we're also committed in that way to help change the narrative, because I think the stories aren't always told. So just wanted to put in that piece as well.
Yes, thank you, Kim. And you have a lot of healthcare. It is the Healthcare Financial Managers Association sponsoring. So there is a question related to if there were one or two health outcome metrics to rally the state around improving, what do you on the ground think that those would be?
I mean, selfishly, I would say economic stability and access to education. But whenever you look at any health outcome, there's always intersection with other health outcomes. It's so hard to look at one or two in isolation, because as I mentioned, access to quality education also related to reduction in stress and access to quality healthcare to be able to focus on that education. So I almost would more, instead of focusing on one or two health outcomes, I would love to focus holistically on how all of those outcomes intersect with one another, and how can we develop systems that really bring people up, focusing on how those outcomes all intersect. So that would be what I would say about the health outcomes, but it might just because I'm indecisive and can't choose one, but I really do think it needs to be looked at holistically.
Yeah.
Sorry, go
Oh,
ahead.
go ahead, Richard.
Oh, I was just gonna say, sort of echoing Lauren's ideas about sort of economic policy and the way that can be beneficial. The mayor here in DC actually just approved sort of large grants to folks that qualify for actually purchasing their first home, right? Up to $200,000 in home buyer assistance. Those sorts of policies actually do a lot to allay the fears and concerns that parents here in Ward 7 and Ward 8 wrestle with on a daily basis. I mentioned before that, park restoration and revitalization, it can't happen in a vacuum here, right? When the park gets nicer, home values inevitably start to go up. And so if you're fixing up the park and doing all these things without addressing the crisis of home ownership, of Black home ownership in Ward 8, then you're kind of missing the point. And so short-term solutions that support adults in Anacostia are initiatives that help increase home ownership, like what the mayor just passed. And secondly, I think any investment in young people, right, as the next generation of environmental stewards, of empaths, of business leaders, the more that we can get them knowledgeable and educated about the massive natural resource in their backyard, the community asset that it is. I think that's actually sort of the smartest return on investment, right? And investing in that generation and getting them knowledgeable about all these different ways to access healthcare outside of just going to the doctor and all these things, but going to the park and creating developing a regular recreation habit.
Thank you. Well, I'd love to listen all day because this is great work you all are doing, and but we are running out of time. So I do want to take the opportunity to thank Carefirst and Kim for coordinating this great panel. Thanks for all who participated today. On behalf of HFMA, I thank you. And I'd also like to bring up a couple of events that are coming up on September 13th. We have an event called A Brave New World for Physician Practices. On the 28th through the 30th, we have our fall conference in Cambridge, Maryland. And we will be starting up the bi-weekly coffee break and networking sessions beginning Friday, October 7th through December 12th from 8 to 8:25 each morning. We do have an afternoon session this afternoon, so we hope to see you back. And again, thank you to our panelists and to Kim for facilitating, and thank you to the Zoom committee that works behind the scenes, and Aaron Foreman, the chair of our program committee. Have a great day, everyone. Thank you.
Take care.